against the motion, and that is that to invest, it is actually better to invest in people. Our first speaker would be Dr. Kim. Dr. Kim? Dr. Kim is, as I mentioned, Dr. Kim is a radiologist and he's also a journalist. So I'm sure he will have a lot to say about why it is better to invest in people. Dr. Kim, please.
Thank you. So I'm a journalist. That's why the chairman put me the place of the against. The journalists always like to say no or against. And nowadays, many hospitals try to have the updated medical facilities competitively. They are advertising their dramatic effects because it is helpful to make patients know that hospitals are well developed. It can be contribute to appeal more patients to hospital. The lobar surgery or radiation thermotherapy would be the example. But patient or medical consumer still make a decision based on quality doctors. On media, they frequently cover well-known doctors in various fields. However, it is rare to cover introduce in certain medical facility on media. I can tell you what medical consumer thinks. Here is the survey taken by the medical job website. They asked 310 people what the major factor is to choose hospital. 70% of people choose doctor's excellence and specialty as a first priority. Second priority was kind medical services, such as a detailed explanation about the disease and quality service. So those are results. The major respondent, the doctor's quality and the kind service for choosing the hospital. So only, meanwhile, only 70.7% of the respondents choose the good medical facility and equipment as first priority for choosing hospital. Few people answered the convenience and access to hospital, the recommendation from the others, and so on. As you know, we can see that doctors' excellent skill is the best standard to choose a hospital because their main purpose of the visiting hospital is to get diagnosis, treatment of disease. Ten times the people select the doctor's excellence rather than good facility. The core point of the medical service is, the core point of the medical service is soft touch, not hard touch. Some field can be exceptional. The highly technology dependent field, or if the medical service can be complete with the only once or twice procedure, such as a LASIK or dermatology laser procedure. In this case, investment in medical facility is very important, but it can make a synergy effect on PR or advertisement. But general hospital is totally different. Hospitals are targeting the regular patient or patient who have chronic disease. So the modern medicine is getting specified on aging society. Disease pattern is getting complicated, showing the worsening or recovering of the chronic disease. That means it is difficult to patient disease by only one application of the medical facility. Technology is being, on the other hand, the technology is being developed too fast. So today's cutting-edge device can be old-fashioned device tomorrow. Therefore, the great doctor with medical knowledge, with good attitude, will be the best specialty for hospital. The first standard to choose the hospital for patient. I want to emphasize humanism is getting more important as the technology is developed. So the best way to be seen as a good hospital is to invest in doctor and people rather than medical facility and equipment. Thank you for your attention.
Thank you. Thank you, Dr. Kim. We now know that if we want to talk to journalists in the future, probably if you want to get the message A across, you better talk something about B. So they would report A in the newspaper. The next to speak for the motion is Ms. Fatima Lee. She is a ward manager in Queen Mary Hospital. She is a very experienced nurse, and she's also an expert in lean management and hospital improvement and transformation projects. So, Ms. Lee, 4 minutes.
Okay. Dear ladies and gentlemen, in the following minute, I would like to introduce to you how the literature support our talk about using the invest in the new facility and equipment is better than in the people's. In year 2000, we found that an Express Healthcare Management said that right investment decisions for a hospital project, 80% of them should be allocated for the building and the equipment, and remaining 10% for the human resource. Why he say so? Because as an excellent hospital, we have to provide the diagnosis, treatment, and care for the patient with wide range of sickness and injury. It is essential to have an extensive range of well-maintained and also up-to-date equipment. It is why an excellent hospital is different from an ordinary hospital. Although someone may tell you that an empirical study found that the technology investment is also have a significant managerial effect on hospital quality performance. For healthcare worker, we know that it can provide a large input into the healthcare. And one of the major resource for problem in this healthcare professional is that the recruiting and retaining them is important. But due to the poor working environment, most of them will resign from the hospital. So, according to the Registered Nurse Associations, said that providing a safe and healthily working condition for employee is one of the best investment to a business. And a telephone survey of 500 nurses showed that 87% of the interviewee agreed that the working in a well-designed hospital would help them to do the work better. And also, an renovation of an inpatient nursing unit can help to reduce the nurse attrition rate from 23% to 3.8%. According to the literature, we can clearly show that invest in new facility and equipment can help to improve the patient and staff safety, and more efficient care and accurate care can be provided to the patients. Linked to the health, because immediate care can be provided to the patient, it will improve the staff and patient satisfaction. At the same time, more time can be released for the patient care. It tells us that more soft touch can be provided to our patients. And it can also help to boost the revenues, decrease the expense, and also improve the staff morale. Provide opportunity for staff training, because some video conferencing can help us to provide immediate training and simultaneous training for the healthcare professional. And at the end, it can also help to improve the hospital reputation. As a result, provide the ability of a hospital to reach the goal of high quality of care and improve the health outcome, which is the core component of an excellent hospital.